So welcome Dr. Shanti to today's session is on teaching. So today we will have 4 tasks. Okay. Your time starts now.
Yes. Hello, I am Shanti, one of the registered in the labor ward. Today, and you?
I'm Sarah, doctor. I just joined. So let me since last 1 week only I have joined. And doctor, I'm very keen to know about vaginal breech delivery. Can you tell me a bit about it?
Yeah, so it is nice that. How is everything in the department as you have joined for 1 week?
Yes, everything is going fine. I'm getting oriented, though I'm getting exhausted with labor ward duties, but things are okay.
Yeah. So have you seen before any breech delivery?
No, but some midwife was telling that she is expecting some patient soon, maybe in a day or two, something like that. She's due, and so I was very keen to know about vaginal breech delivery, how it differs, because I have seen normal deliveries where the presentation is cephalic. So I'm just curious to know about vaginal breech delivery.
Yeah. Okay, Sarah, it is very nice that you have chosen this topic and you are interested to know this delivery. Because this is one of the deliveries which we need skills and also we need practice, and so that will reduce many of the complications that occurs with this delivery. Okay, so Sarah, so today will be I'm happy to be here with you to teach you regarding this vaginal delivery. So first of all, I will tell you regarding what are the contraindications of breech delivery, where it is not favorable for the breech delivery, and what we should have, and how different techniques of delivery of the breech. And at the end, I will also give you some reading materials, some articles, some RCOG videos. You can regarding the breech delivery, you can go through that. And at the end of the discussion, you can, I want also some feedback. How was the session? And you can stop me at any time. Okay? Is that be fine?
Yes, doctor. Yes,
Yeah.
yes.
Okay. So, Sarah, first of all, whenever as we are in the labor ward today, so first of all, we have to make sure that whether this delivery some information we need to know from the patient's notes and also patient history, whether she is supposed this vaginal delivery is possible or not. So some of the things, contraindications for this vaginal delivery is the type of breech. So it should be flex breech, and it should not be any hyperextension of the neck and also it should not be footling breech. And other thing is that the baby weight should not be more than 3.8 kg or should not be less than 10 centile. Okay. And also the most important thing that the person who is conducting the delivery should be experienced and well versed in the vaginal breech delivery, and we should have the facilities of for the cesarean section immediately. And we have to involve the team of multidisciplinary team of doctors, including we have to call the neonatologist for the resuscitation. We have to make sure that operation theater is available and also anesthetist is informed regarding this case, and also we have to inform our consultant because we need to have maneuvers and also we need other senior midwife and other midwife for the support. Okay.
Yes, yes,
Yeah.
yes.
Yeah. So can you tell me which is the one of the contraindications for this delivery?
There should not be hyperextension of the neck, I guess.
Yes, yes, Sarah, you are
And
very.
birth weight should not be less than 10 centile. That is what.
Yes, yes, yes. Sarah, you are very good learner, and I am very happy. And Sarah, now let us see. Now we have the patient now, and she is for the vaginal breech delivery. So, whenever anyone is calling for the breech delivery, first of all, we have once we are here. We have to inform the patient that we have to take her consent that there may be what are the complications can occur during the breech delivery for the mother and for the baby, and we have to reassure her, and we may require some maneuvers during the delivery. And as I said, we have to make sure that the baby neonatologist is available, and also we have to inform the consultant. And so the first of all, we have to make sure the CPG is normal and how is the contraction, and if she's fully dilated. So let's see if this is fully dilated, we will do the breast delivery. Is that be fine?
Yes, yes.
Okay. So first of all, so patient has to be whether it is lithotomy position or left lateral position, or it can be also a standing position. Breech delivery can be done. In case of upright position, usually it decreases the second stage reduces second stage of labor and also decreases the maneuvers. So first of all, we have to put the lithotomy position, whichever the position is favorable for the patient. And so we are all the we have called for help and we explained everything. And then first of all, we should not hands off technique. So we should not do any maneuver. We'll with adequate contraction and then continuous CPG monitoring. So the bridge should deliver normally up to the level of the umbilicus. Okay, so in case of flexed bridge, so and if with contraction, we have to see the buttock is delivered and up to the level of the umbilicus. And so we have to make sure that the back of the baby is always anterior. Okay.
Yes, yes, yes.
Okay. Okay. So once if there is any delay in the delivery of from the button to the head of the delivery, that is more than 5 minutes, or from the umbilicus to the head delivery more than 3 minutes, or any procedure up from the delivery of the pelvis to the any procedure is more than 90 seconds. In that case, or there is difficulty in delivery of the fetal leg, in that case, we need to interfere. Are you with me?
Yes, yes, doctor.
Yes.
Yes. So the
Yeah.
timing is important. You mean to say we need to.
Yes, timings. Yeah. Yeah. So after that, suppose there is the difficulty in deliver the fetal leg. So in that case, what we do is we have to put the two finger inside through the back of the babies and then flex the popliteal fossa and hold the foot and then deliver one by one. Okay. So after that, we keep the baby anterior, keep the baby's back anterior and put the one breast towel so that there is no slippage, and we have to hold the baby in the pelvic region, and we should not hold the soft part so that there is increased risk of injury. Okay, so after that, once the neck is the scapula is visible, we have to make sure there is no hyperextension of the hand. So so if there is any knuckles hand we call it. So if there is hand is behind the neck, so what we have to do is first of all, if it is right hand of the baby is behind the neck, so we have to turn the baby trunk 90 degree to a right side towards the left side, and then take your two fingers behind this back of the baby's shoulder and flex the elbow, and then hold the hand and sweep around the face and then chest and then deliver one hand. Then to deliver the other hand, so turn the baby to 180 degree to the other side, and then so that this arm comes behind the pubic symphysis, and then similar way you hold flex flex the hand and then deliver the other hand. So next after that, so you have to hold the baby. Your baby should lie down on the left hand, and then after that we will wait for the contraction if the mother is pushing. And after that, if there is delay in the delivery of the baby, so we have to use the some maneuvers. We call it the Smelliver technique, in which the baby's trunk will be on the left hand, non-dominant hand, and the two fingers, that is the middle index finger and the middle finger should be on the malleus prominent to flex the baby's head, and whereas the other hand we have to go for from the behind, and the index finger and the ring finger should be on the shoulder for the traction, and the middle finger should be on the occiput for the flexion. Okay. So we have got to hold the traction and the flexion and then deliver the baby, and at the same time we have to tell one of the assistant, one of the colleague to give suprapubic pressure and ask the mother to push, and if needed, so episiotomy has to be given up from the below, and somebody has to support the perineum. Okay, so just deliver the baby. Okay, once we have delivered the baby, we have to cut the clamp cord, and then we have to take the cord blood pH, and we have to hand over the baby to the pediatrician. And so in case suppose the baby said does not deliver in this maneuver, so what are the other options would be? We have to inform the consultant urgently to attend, and we have to use the papers forceps. Are you with me, Sarah?
Yes, yes, doctor.
Yes. So next we have to do the papers forceps. This is a special type of forceps for the breech delivery. In that, so what is that you have to we have to continue the CPG. That is the back on the. We have to put the CPG machine on the back of the baby and near the left shoulder. And after that, one colleague will just lift the baby just horizontal, just above the
Time is
horizontal
up.
line.
Doctor, time is up. Time is
Uh,
up.
did
Doctor,
not even reach. Did not even reach half.
no, you were up to the head delivery. Okay. So let's divide and understand what is expected from the task as such. Okay. So this is a teaching task. You have performed quite okay. I'll say this is a borderline pass station for you. Okay. Now, why I'm saying not a complete pass? First thing, the station is not complete. Okay. Second
So,
thing is that you could have saved time at multiple places that we will discuss. Okay. Now, let us, after introducing your introduction of each other, you have appreciated the role player, appreciated her keen interest to know about the vaginal breech delivery, etc. Now, this for this particular station, they might give you the mannequin, or they might give you the baby and the doll, I mean to say, and the pelvis. Okay, so this you might have to demonstrate. Okay. Second thing is that in this particular station, when you start what are the different ways for the vaginal breech delivery? One, it is an ECV. Second, it can be cesarean section. And third, it can be vaginal breech delivery. Okay, these are the three things which you should discuss, and always external cephalic version first. Okay, and if the version is contraindicated, patient is not willing, a patient insists on the vaginal delivery, okay, does not want the cesarean section, in that case the vaginal delivery is going to be the most important. Now, what are the advantages of cesarean section? What are the advantages of the vaginal breech delivery? Okay, then because it is going to avoid the cesarean section, it will avoid the long-term complications of cesarean section. Okay, because patient will deliver vaginally, so long-term complications will be avoided. However, the perinatal, in short term, perinatal morbidity and mortality is little more in vaginal breech delivery as compared to the cephalic delivery. However, the long-term complications, long-term outcome for vaginal breech as well as cephalic presentation remains same. Are you getting it?
yes, yes, yes.
Okay, so these are a couple of points related to the applied clinical knowledge. Now, these points, if you feel that this particular information, if I say in the beginning, I might lag behind the
Yeah,
covering of
time.
the task, then keep this
Yeah.
particular information at the end, because there are three modes of delivery that you can just begin, out of which we will learn about the vaginal breech delivery, and then you start. You got it?
Yes, yes.
Now, what is the difference between the vaginal delivery and the cephalic presentation? In cephalic presentation, there is a time for the molding. There is a time, some amount of caput and some amount of molding is there. And to certain extent, it is normal. It reduces the diameters and it helps in safe vaginal delivery. While in this breech presentation, the mechanism is happening at three places: the buttocks, the shoulders, and the head, out of which the buttocks and the shoulders are soft and compressible, so they come out easily. However, the head does not get adequate time for the molding. You got it? So
Yes.
there is a difficulty at the delivery of the head. Okay. Now, then you go stepwise. Okay. First is a patient selection. Okay, patient selection, all the parameters you have mentioned well. Only thing is that birth weight is, I think, 1.5 to 3.8. Okay. I think you mentioned about 2.5. I think it is 1.5 to
Three, no.
3.8.
No,
That is what.
I said, yeah, I told only 3.8. I should not be more than 3.8. Yeah.
Yeah, yeah.
Mm.
That is about the weight. Second thing is that when you are performing the task, I felt you are giving a lot of information and
Mm.
less checking of the understanding. You did check the understanding, but
Mm.
the information which was given was very fast. Okay,
Mm.
that particular thing. Then hands-off approach, the principles of the vaginal breech delivery, that the back should be anterior, there should always be pushed from above and never pulled from below. These are the basic 3 principles which you have to mention. Where the delivery should be conducted, it should be conducted under the supervision of a trained person. It can be conducted in the labor ward. No need to conduct the delivery in the operation theatre. However, the operation theatre should be ready for the cesarean section. Okay. Now, what you do, you have these particular points ready with you, and then you see to it that in one sentence you cover 3-4 points, and simple point you ask the role player immediately. Okay. So, like where we are going to conduct the delivery, we will conduct the delivery in the labor ward. However, we'll keep the cesarean section theatre. So there are hardly 10-12 tasks for the teaching maximum, and especially in such cases, you should always keep the things ready which you are going to ask the role player. Simple things. You got it? So this is what about the patient selection, and what is the difference between the cephalic and the vaginal breech delivery. Then you have mentioned about the position of the patient, hands-on approach, that is right. Okay. Then if you can mention about the names of the manure, that is the Pinard's manure and Lawson's manure, well and good. Okay, if you can't remember, you have described the manure, that is also fine. Okay. Then comes the chances of the cord prolapse are high. Second thing is that there is no role of induction in the vaginal breech delivery. We can augment when the contractions are inadequate. Okay, so these are few points which should come. They are given very properly in the guideline. Okay, so those sentences are important. Okay, so after the delivery of the legs, the trunks, then you have mentioned about the nuchal displacement of the arms. Okay, then comes the delivery of the head. There you eliminate all 3 manures, out of which actually this Marusis Melibet and the Piper's. These are the only 2 manures which you should discuss. Okay, Burns Marshall no one uses now. Okay, so at least you name 3 and describe 2. Okay, that is the Marusis Melibet which you have described properly. Second comes the this Piper's forceps. Okay, then do not forget to complete the station after the delivery. Third stage will be managed like any other normal active management of the third stage of the labor. Pediatrician's attendance is going to be important. Okay, if the baby does not cry, then we'll send the paired cord blood samples. Okay, so even if you tell this much information, that is going to cover the station properly. Okay, and rest of the things we have mentioned in the beginning only. I'll be giving you the videos and the information leaflets, etc., etc. Okay, there you can also mention about the mechanism of labor. Mechanism of the labor video regarding mechanism of labor, because mechanism of labor is different and the conduct of labor is different. Mechanism of labor we discuss about various diameters, and we do not have that much of time to discuss. Okay, so you mentioned about the mechanism of the breech delivery. I'll be giving you the video, which diameters, how exactly. So whatever we have discussed is the clinical management. Okay, so we should go in that particular way. Is it clear to you?
Yes.
Yeah. But you have covered all the points, and you are up to the delivery of the head. Okay, so I think it was a quite good station. Okay, for teaching breech delivery. So singleton term breech delivery more than 37 weeks. Another thing, preterm vaginal breech, and if the breech comes undiagnosed breech. Okay, where we have not given the option for the vaginal breech delivery, we can counsel regarding the vaginal breech delivery. Second, if the time is adequate, we get a ultrasound done and confirm the whether there is no hyperextension of the neck, and then offer the option of vaginal breech delivery. Okay, so these were the points. Here it is 1.5. Rest of the things are quite there. Patient selection, the criteria for the vaginal breech delivery. Okay, pelvis should be adequate, fixed or neutral head, or no flexed or neutral head, and there should not be hyperextension of the neck. Then advantages of the vaginal breech delivery: it avoids the abdominal surgery and its risk, shorter maternal recovery time, reduced risk of surgical complications, thromboembolism, and future adhesions. Okay, this is in a section pros and cons. Advantages: it reduces the risk of perinatal mortality and mortality in breech. So that is one of the advantage. Then avoid the risk of entrapment or the head delivery difficulties. And even in a normal, what you can say, the when all the criteria are satisfied, head delivery is the tricky. So we should be able to reach up to the head delivery. Okay. Then disadvantages are maternal risk like bleeding, infection, injury, longer time for the recovery, and implications for future pregnancies like chances of placenta previa, uterine rupture, etc. Because it is an elective cesarean section. Okay. Then what is the role of ultrasound that we should mention? Confirm the type of breech, assess the fetal head position, whether it is flexed or extended, estimates the fetal weight and amniotic fluid volume, helps decision making. So ultrasound we have to speak. Okay. Then preparedness for vaginal breech delivery. Delivery only in tertiary care or well-equipped unit. Trained personnel available, senior obstetrician, experienced midwife, anesthetist, neonatal team should be ready. Facilities for immediate cesarean section should be ready. Inform maternal consent after counseling, including term breech trial visits. In perinatal morbidity and mortality, vaginal breech carries higher perinatal morbidity and mortality compared to elective cesarean section. Counseling should cover these risks and documentation is essential. Then intrapartum care, continuous electronic. This also there has to be continuous electronic fetal heart rate monitoring because it is one of the indications for electronic fetal heart rate monitoring. Okay, continuous CTG monitoring is mandatory. Adequate progress of labor. Augmentation is actually recommended when the contracts, but induction is not recommended. Okay,
Yeah.
avoid instrumental rotation of the breech. Then technique of vaginal breech delivery, hands-up approach until delivery of the term, allow spontaneous descent up to the umbilicus, support buttock and thighs gently, avoid traction. This you have covered by. Okay. Manuals for difficulties, difficulty in delivery of the arm or nuchal cord, Lausset's maneuver, rotation of the trunk to release the shoulders. Okay, so you'll release the shoulders by using the Lausset's maneuver. When there is a difficulty in delivery of the head, we have MSV technique and forceps delivery. So these are actually only two indicated. Third, you can just mention, but however, it is not used. Okay. Then counseling and resources, reference to term breech trial, reduce perinatal risk with planned cesarean section but increase maternal risk, provide information leaflet on breech birth, encourage use of video resources showing mechanism and manuals. Okay. So teaching and communication skill, use clear language suitable for SHO level, encourage questions and check understanding, use diagrams, pelvic models, hand gestures, highlight team approach and patient safety, end with signposting further learning resources like leaflets and video. Okay. So that is what is the way of presentation. Your presentation is quite good, doctor. Preparation is good. Only thing is that from teaching aspect point of view, you need to be little slow and ask for simple questions. Okay, in between, check the understanding in between. And here generally it will be a, if you get a breach, it will be a single task. There will not be associated bullying or something because itself is a big topic. Okay, but as usual we will always ask the questions, one or two questions about the department and all. Okay, so that finishes this particular task about the breech delivery. Okay. Yeah, your task time starts now.